Sudden cardiac death is described in good amount of clinical scenario, commonly in adolescence age and a little bit in the grown-up age. So, what are the causes? These people usually have some unrecognized critical sort of cardiac ailments like aortic stenosis, severe critical aortic stenosis. They may have, hypertrophic dilated cardiomyopathy, either, and they may die suddenly. And Sean complex, the aortic stenosis, mitral stenosis, coarctation of aorta, and hypoplastic left aorta syndrome, left ventricular syndrome, all three, four can have variable combination and can have this sort of sudden death in the adolescents and then adult people. So apart from that, the ischemic heart disease like ischemic anomalous origin of the left coronary artery, your pulmonary premature atherosclerosis, and your familial hypercholesterolemia, progeria, then again it has also premature hypercholesterolemia, and your coronary inflammatory disease like KD, Kawasaki disease unrecognized, leading to this coronary aneurysm and this sort of mishap. So ultimately, these children, these adolescents and adult, they may die unrecognized death. We heard very often that he has some unrecognized cardiac things and he died all on a sudden. So they are diagnosed in screening, neonatal, and thereafter in regular health visit or whatever, and the murmur clinically and hemodynamic alteration features, little bit of left ventricular strain failure, right ventricular strain or failure, and echo color Doppler, initially 2 maybe, can be diagnostic. So these things are more common in the Downs, the Turner, Dijors and others, but they are obvious by their other clinical features and genetic testing. So really, the autoimmune disease, the hypertension, unrecognized hypertension, like like polyarteritis nodosa, your Williams syndrome, they have hypercalcemia, alpha phases, and then the collagen disease. They have their unique features. So these things are also obvious. At times, good amount of time, there is nothing obvious, and all on a sudden death. It's a worrisome thought of things. So these are the way that you can recognize these things, and the intervention of those identities are essential. For example, in aortic stenosis, you can go for the valve resection. You can for the Cone procedure, that is borrowing spaces, and finally aortic valve replacement. So and then good amount of time in the terminal events, in the quite a long after quite a long time, you might need the cardiac transplantation, which is frequent in the West. So these entities can be screened out and can be treated early, and these deaths can be avoided in the scientific way.